The relationships between infants and toddlers and their caregivers are the cornerstone of positive, healthy development and directly affect children's well-being and social-emotional development. But what factors of this relationship are most important? What factors lead to quality relationships? As we prepare individuals to work with infants and toddlers, what qualities of relationships should we teach about and encourage? A relatively recent construct of quality infant-toddler caregiver relationship quality that is receiving a lot of attention is mind-mindedness. Mind-mindedness refers to the caregiver's ability to view and treat the child as an individual with independent thoughts and feelings. Mind-mindedness is a caregiver's ability to be tuned in to the child's mental states, such as thoughts, desires, emotions, and intentions, and is a measure of the quality of caregiver-child interactions. Many studies have explored mind-mindedness in mothers, finding that maternal mind-mindedness is positively associated with maternal sensitivity, a caregiver's ability to appropriately and promptly interpret and respond to children's signals and emotional needs. Furthermore, parents' mind-mindedness is found to be associated with child-secure attachment, as well as with child social development. Mind-mindedness, thus, is an important element of caregiver-child interactions, as previous studies have shown the contribution with young children's secure attachment relationship and social-emotional development. Infant-toddler teachers in childcare are, just like parents, expected to tune in to what children are thinking and feeling, which makes mind-mindedness an important construct in the relationships between infant-toddlers and the teachers who care for them. However, it must be emphasized that mind-mindedness is about caregivers doing more than just giving care. As a teacher of infants and toddlers, there are general duties and responsibilities you have, such as various care routines, feeding, cleaning, diaper changing, etc. But these care routines can and should be more than just routines that are performed by going through the motions. Mind-mindedness is about being so well tuned in to the infant or toddler that your thoughts and behaviors are in sync with their thoughts and behaviors. For an infant-toddler teacher to be so tuned in with the child that you can just about predict their behavior means that you are constantly, closely observing and reflecting on your relationship with the child, not just moving through the motions of care routines. With every action you take, what do you think the child is thinking? As you observe the child's minute behavioral responses during interactions with objects and people, can you imagine what they are possibly thinking? As infants do not produce a lot of speech yet, and toddlers are still improving in their language, are you in sync enough with children to potentially speak for them? Reveal in your words what they might be thinking or feeling? How do we find out about the mind-mindedness abilities of infant-toddler teachers? Mind-mindedness is typically assessed by observing how often the caregiver uses mind-related comments during caregiver-child interactions, referring to the cognitions of the child. For example, you know this song. Desires, for example, you like this game. And emotions, for example, I see you are angry. They are, therefore, a manifestation of the caregiver's ability to understand the perspective of the child and to express their understanding verbally. This video will briefly summarize a few main findings from a research study titled Caregivers' Mind-Mindedness in Early Center-Based Childcare. 99 teachers of children between 0 to 4 years of age were video recorded for 20 minutes during sessions of play and mealtime. Teachers' mind-mindedness comments were classified by the category of internal state to which the teacher referred. There are 5 categories of mind-mindedness comments. Comments on desires and preferences related to things the child likes, dislikes, loves, wants, or hates. Comments on cognitions were associated with what the child thinks, decides, notices, is interested in, expects. Comments on emotions referred to the emotional states like happiness, shyness, stress, or joy. Epistemic states related to teasing and joking. Talking on behalf of the child was coded for any comment that was obviously meant to be said or thought by the child. Furthermore, All mind-mindedness comments were dichotomously coded as mental state comments that were appropriate tuned-in reflections of the child's mental state, or mental state comments that were non-attuned to the child's mental state. Mind-related comments were appropriate when they were consistent with the child's current behavior. For example, the teacher saying, "You like this book," when children were reading the book with interest. When they were linking the current behavior with a similar event in the past or future. For example, the teacher saying, "You know already what will happen in this book," during the reading. Or when they were clarifying how to proceed after a lull in the interaction. For example, "You'll like the next game." Mind-related comments were non-attuned when the attributed internal state appeared at odds with the child's behavior. For example, the teacher saying, "You like this book," when the children do not seem interested in the book. Or when the mental state comment about the children's past or future behavior was unrelated to the children's current behavior. For example, the teacher saying, "You already know what will happen in the book," when the children are not looking at the book. In addition, teachers' comments were qualified as comments toward an individual child, individual mind-mindedness, or toward more than one child, group mind-mindedness. The results of the study found that, in total, about 10% of teacher vocalizations were considered tuned-in mind-mindedness talk. Although 10% does not seem very high, this mind-mindedness rate is similar to the findings from other studies at childcare and between parents and children. Non-attuned comments from this study occurred about 0.5% of the time. This low rate of non-attuned talk was also similar to previous studies. While we as teachers of infants and toddlers can consider increasing the amount of mind-mindedness talk we engage in with children, perhaps more important is to ensure that this talk is tuned in to the child and not non-attuned talk. The results also suggest that mind-mindedness in center-based childcare is an indicator of the quality of the relationship between the teacher and the group of children, and is influenced by the number of children, their ages, and specific situations in the childcare program. Overall, teachers produced more mind-mindedness talk with individual children than with groups of children. Comments toward infants were more likely to be addressed to specific individual children, but as the child's age increased, more group-related mind-mindedness comments were likely to be experienced. A possible explanation is that teachers' mind-mindedness is attuned to the social development of the child. In infancy, individual teacher-child interactions are more common than group interactions, whereas in toddlerhood, teachers are more focused on the group setting in which inclusion, sharing, and involvement are essential aspects of the interaction settings. Nevertheless, the fact that teachers produced more mind-mindedness talk with individual infants and toddlers than with groups suggests the importance of implementing and supporting recommended infant-toddler program policies such as primary care, small groups, and individualized care. In summary, teachers of infants and toddlers generally offer a supportive environment with the use of mind-related comments and sensitive interactions, and are able to treat children in the group as independent mental agents by appropriately referring to children's inner states, such as their desires, thoughts, and emotions during their daily dyadic and group interactions. The results of the study also suggest that mind-mindedness in center-based childcare is an indicator of the quality of the relationship between the teacher and the group of children, and is influenced by the number of children and their ages in the childcare program. Mind-mindedness is a construct that has research-supported benefits for young children and is free and easy for us to implement into our everyday interactions at work with infants and toddlers. Mind-mindedness refers to the ability to view and treat the child as an individual with independent thoughts and feelings, and to be tuned in to the child's mental states. We can easily implement mind-mindedness through our conversations we have with children. Comment on children's desires and preferences. Comment on what children think, notice, are interested in, and their expectations. Comment on children's changes and emotional states. Even with infants and toddlers who do not produce much language, mental state conversations are still significant. You can act like a narrator of their mental states, using their behavior to narrate what they might be thinking and feeling. Think of yourself like a sports broadcaster, but commenting on what players, infants and toddlers, might be thinking, not just what they are doing. Working with infants and toddlers involves countless interactional opportunities, but are these interactions high quality? One way to provide quality interactions is to be tuned into the child or children you are interacting with. Even care routines like changing diapers are golden opportunities to provide a child with a rich investment of quality interaction, one that could include mind-mindedness conversations, where you verbally reveal the hidden thoughts of a child. Importantly, remember that your conversation should be tuned into the child and not non-attuned talk. As a caregiver of infants and toddlers, you have the opportunity to make a long-lasting, positive impact. Mind-mindedness conversations are one easy tool to help you do so.